The member for Memramcook-Tantramar.
Mr. Speaker, it's been 6 years since New Brunswick's midwifery demonstration site opened here in Fredericton. Despite the pilot success and the wait list caused by high demand, the expansion of midwifery services has been stuck, with the government waiting on a review. Recently, I discovered that review was completed last year and has been sitting on a shelf. It found that 99% of clients were satisfied or very satisfied with the midwifery care they received, and that those receiving midwifery services had much lower levels of labour induction, despite New Brunswick's overall induction rate increasing over this period. The evidence clearly shows that midwifery care can provide the best outcomes for low-risk pregnancies. Considering that, the report recommended both making the Fredericton program permanent and expanding midwifery services across the province. When will the Minister of Health be implementing these recommendations?
Minister of Health.
Well, thank you very much, and I appreciate that question. And that is a report that was received, Mr. Speaker. I know it's taking longer than the members opposite want to stress. And the report is with staff. We're reviewing some of those items, and at the appropriate time, we'll be revealing that and our direction on that particular midwifery file. Thank you.
Member for Memramcook-Tantramar.
Mr. Speaker, the government has had this report sitting on the minister's desk for a very long time, and it's clear this minister doesn't have a plan to improve midwifery services in New Brunswick. The government requested this report to assist in making evidence-based decisions, but when they didn't like the evidence, which would require making investments in our public health care system, they buried the report. Both this government and the previous Liberal government have moved too slow on this file. The report also made recommendations on how to improve recruitment, retention, and availability of midwives. Specifically, it calls for dedicated New Brunswick student program spaces in existing midwifery training programs outside the province, and funding and supports for midwifery students who agree to practice in New Brunswick. This government says it likes to make decisions based on data, and in this case, the data is clear. I'm going to ask again, when will the Minister of Health make the Fredericton program permanent and expand midwifery services across the province?
Minister of Health.
Well, thank you very much, Mr. Speaker. And when the member opposite asks about a plan, you know, Mr. Speaker, we have a comprehensive plan that includes a number of different items. And the midwifery one is part of that plan when we talk about reviewing the data and looking at that. But I do want to thank the New Brunswick Health and Senior Care Council for coming out with their quarterly report and talking about the provincial health plan, Mr. Speaker, which encompasses all the province of New Brunswick and talks about access to surgery, access to primary care, access to senior care, access to mental health and addiction, and a connected healthcare system within the province of New Brunswick. And the healthcare initiatives this quarter, there's a quarterly report, have gone from 15 complete to 20 complete, Mr. Speaker. That's progress, that's moving the province forward, and we know that there's lots of work to do still. There are still 13 initiatives that are in progress, and one that wasn't done by the start of the report or the release of the report, but it's underway now. Mr. Speaker, we're moving forward with a comprehensive plan for the province of New Brunswick.